Okay, so let's unpack this a bit. Imagine you're at the vet's office, and they tell you your dog or maybe your cat has white blood cells in their urine.
It sounds...
Well, it doesn't sound great, right?
Right. Not ideal.
And your mind probably jumps straight to, okay, is this bad? What does that actually mean? And maybe the biggest question is, how on earth do they figure out why those cells are there in the first place?
It's a finding we definitely see quite often, but like the source material you shared makes really clear, it's not a simple diagnosis at all.
Yeah.
It's more like a flag, a signal flare saying something's up.
Exactly. So that's our mission for this deep dive. We're taking these source excerpts you gave us about pyuria. That's a technical term, right?
Yep, pyuria, white blood cells in the urine.
Okay, pyuria in dogs and cats, and we really want to dig in. Understand what it is, why it happens, maybe what it looks like for your pet, and how vets actually investigate to find the root cause. I'm actually really curious to explore all the layers packed into this one lab finding.
It does seem pretty straightforward on the surface, doesn't it? White blood cells, urine.
Yeah.
But the details, the nuances in these sources, they're absolutely key to understanding what it really means.
Right. Okay, let's dive into that first bit then. What is pyuria according to the sources? How do they define it?
So at its core, it's finding white blood cells, neutrophils, sometimes others in the urine. The source specifically says, usually if you see more than 5 white blood cells per high-power field, that's looking under the microscope at the sediment, then it's generally considered abnormal.
More than 5 per high-power field. Okay, that's the line. But you said usually, and the sources jump right in with context, don't they?
They absolutely do. And this is like a really key point right off the bat. That number, that count, it can be really affected by a whole bunch of things.
Like what?
Well, think about how the urine sample was collected. Was it caught midstream? Was it a cysto? How much urine was in the sample? How concentrated was it? How long did it, sit around before the lab looked at it? And even the specific lab technique they used, all that stuff can change the count.
Okay, so it's not just some fixed number you can hang your hat on without knowing the backstory.
Yeah.
Adds complexity right away. So stepping back a bit, why are white blood cells even in the urine? What's actually happening in the body?
Well, if you're seeing a large numbers of white blood cells, especially in a sample the animal just peed out, normally avoided sample, that's a really strong sign. It signals active inflammation somewhere along the urogenital tract.
Inflammation. Okay, so the body's defense system is like reacting to something.
Precisely. The sources explain pyuria happens with basically any process that causes cells to get injured or die in those tissues.
Any process, like infection.
Or, it could be infection, bacteria, fungi, that sort of thing. Or it could be non-infectious, like trauma, maybe stones, even certain toxins. When that damage happens, boom, it triggers inflammation.
And inflammation means white blood cells rush in.
Exactly. It's exudative inflammation. The white blood cells actually leave the bloodstream, that's called extravasation, and they move into the damaged tissue.
Okay.
And if that tissue is part of the urinary or genital system, those white blood cells end up spilling into the urine. That's your pyuria. This whole inflammatory process also makes the blood vessels leakier.
Ah, okay.
Which is why you might see blood hematuria or proteinuria in the urine at the same time.
Got it. So it's like the body sending in the emergency crew to a damaged site. Okay, so where exactly could this inflammation be happening? Where in the dog or cat's body could lead to white cells in the urine? The sources listed quite a few spots.
Yeah, if you look at the possible locations, it could be in the renal or urologic system. So that's urethra, bladder, ureters, kidneys, or it could be coming from the genital system, things like the prepuce or prostate in males, vagina, or uterus in females.
Wow, okay, that is a lot of territory. Kidneys all the way down to the outside bits. So if inflammation's happening in one of those areas, causing pyuria, what might you, as the pet owner, actually notice? What are the outward signs?
It can really vary quite a bit. It totally depends on the underlying cause, which organs are actually involved, how bad the inflammation is, and whether the body's reaction is just local or if it's become more systemic, affecting the whole animal.
Okay, the sources split that out, local versus systemic. Go to some of those local signs.
Right. Local signs are basically confined to the area that's inflamed. You might notice, say, redness on the surface of the vagina or the prepuce.
Okay.
Maybe tissue swelling. like the kidneys feel bigger when the vet palpates or the bladder wall feels thick. Exudation is another one. That's the inflammatory gunk itself, so the pyuria in the urine, obviously. But you might also see like actual pus-like discharge from the urethra or vagina, or more serious stuff like pyometra, that's a uterine infection or an abscess in the prostate. Pain is a big local sign too. Maybe the pet really reacts badly to being touched there. Or you see signs related to peeing difficulty, like straining or going really often but just small amounts.
Right, the classic UTI signs people think of.
Exactly. Dysuria, polyuria, stranguria, and sometimes loss of function, like excessive drinking and peeing polyuria, or even incontinence.
Those sound pretty miserable for the poor animal. When does it tip over into being more serious, those systemic signs you mentioned?
Systemic signs tend to show up when the inflammation is more generalized or it's hitting vital organs harder, like the kidneys, prostate, or uterus. Think severe kidney infection, pyelonephritis, or pyometra again.
Okay.
The sources list things like fever or pyrexia, the technical term acting depressed, not wanting to eat, being dehydrated. Those are systemic signs. But here's a really key distinction the sources make.
Yeah.
If the problem is just in the bladder, urethra, vagina, or prepuce, and it's not causing a blockage, those rarely cause the big systemic signs.
Ah, that's super useful. So, like a simple bladder infection without an obstruction. The pet might feel uncomfortable, but probably not systemically ill like they would with a bad kidney or uterine infection.
Precisely. That's a good way to think about it.
Okay. So, we know pyuria, white blood cells, equals inflammation somewhere in the urogenital or genital tract. We know why they show up and where they might be coming from. Now, the big one, the list of actual specific things that can cause that inflammation. And wow, this list of the sources it's long. Really shows why diagnosis isn't always straightforward.
It absolutely is long.
Yeah.
And it just hammers home that point. Pyuria is the sign, like that check engine light. It's not the actual problem itself.
Right.
And the list of potential problems is, pretty numerous and varied.
Let's try and run through some of the main culprits the sources mentioned, maybe organ by organ. Start with the kidneys. What could cause pyuria there?
Okay, kidneys. Top of the list is probably pyelonephritis, infection of the kidney tissue itself. Could be bacterial, fungal, parasitic, even mycoplasmal.
Wow, lots of potential bugs. Anything else for kidneys?
Yep, kidney stones, nephroliths, cancer, neoplasia, trauma, or even immune-mediated problems affecting the kidneys.
Okay. How about the ureters?
Yes.
Tubes from kidney to bladder.
Ureteritis inflammation there, usually bacterial. Stones in the ureters, ureteroliths, or neoplasia again.
The bladder seems like a really common one people suspect first.
Yeah, bladder inflammation cystitis is definitely common. Can be caused by bacteria, mycoplasma, fungi, parasites.
Lots of possibilities there, too.
Also, bladder stones, urocystoliths, neoplasia, trauma, even inflammation just because the bladder got way too full from a blockage downstream. Oh, and the sources also mention a drug-induced cause. Specifically, the chemotherapy drug cyclophosphamide can cause inflammation.
Interesting, a drug causing it directly. Okay, urethra, tube going out.
Urethritis. Similar causes to cystitis, really bacterial, fungal, mycoplasmal. Stones in the urethrolyphs, neoplasia, trauma, or a foreign body stuck in there.
Okay. Moving to the genital tract. For male dogs, the prostate.
Prostatitis, inflammation, or even an abscess in the prostate, often bacterial or fungal, and again, neoplasia.
Penis and prepuce area.
Balanopastitis, that's inflammation of the head of the penis and the prepuce. Neoplasia again, or a foreign body.
For female pets, the uterus.
Pyometra or metritis, usually bacterial infections, and these can be really serious life-threatening conditions.
Yeah, definitely heard of pyometra being an emergency. And lastly, the vagina.
Vaginitis. Could be bacterial, mycoplasmal, viral, fungal, also neoplasia, foreign body, or trauma.
Okay. Phew. That is quite the list. It really drives home that seeing those white cells is just the tip of the iceberg. There's a whole investigation needed. Speaking of which, the sources also mention things that make pets more likely to get these problems. Risk factors, right?
Yes, several things can kind of set the stage.
Yeah.
Basically, any disease, any procedure like urinary catheterization or any therapy like maybe steroid drugs,
Right.
that weakens the normal defenses of the urinary tract. That makes them more susceptible to infection getting a foothold.
Makes sense.
And also, any disease or specific diet or therapy that makes metabolic stones more likely to form, that also increases the risk of issues that cause pyuria.
So, other health problems or even treatments could indirectly lead to this inflammation. Which brings us, I think, to the real core of this deep dive. How do vets actually figure out which one of these many, many possibilities is the real culprit? It really sounds like detective work.
It absolutely is a detective process, and the sources lay out how vets gather the clues. One of the very first and maybe most important clues, it comes from how the urine sample was collected.
Okay, how does the collection method narrow things down?
Well, if the sample was just collected when the animal peed, normally avoided specimen.
Right.
Seeing pyuria tells you the inflammation is somewhere in the urinary tract or the genital tract. It's less specific about the location.
So you can't just assume, oh, voided sample pyuria must be a bladder infection.
Exactly. The source really emphasizes this. With voided samples, you absolutely have to consider and try to rule out problems starting in the genital tract, because inflammatory cells from down there, vagina, prepuce, prostate, can easily get washed into the urine stream and contaminate the sample.
Ah.
So you're thinking about things like vaginitis, maybe you see discharge or redness, pyometritis could be discharge, fever, acting sick, big uterus, especially after a heat cycle, balanoposthitis, discharge from the prepuce, prostatic issues, maybe discharge, trouble peeing or pooping, pain back there. And then you still have to consider urethra, bladder, ureters, kidneys too.
Got it. Voided sample, wide search area. What about cystocentesis? That's the needle directly into the bladder, yeah.
Correct. Cystocentesis is kind of the gold standard for trying to bypass contamination from the lower bits, lower urethra, prepuce, vagina. So a sample collected that way with pyuria. That strongly points towards the problem being at least in the urinary tract proper. Bladder, ureters, kidneys. However, here's a really interesting nuance the sources bring up. Even a cysto sample doesn't completely rule out inflammation higher up, like in the urethra or prostate.
Oh, so?
Think of it like plumbing, right? Even if you tap into the bladder pipe, if there's really thick inflammatory stuff exudate from further up the pipe, say the urethra or prostate, it can sometimes kind of slosh back or reflux into the bladder, and then you pick it up even with your clean cysto sample.
Okay, the plumbing analogy helps. So it's much better for localization, but not foolproof for excluding everything below the bladder.
Exactly. Much better, but not 100% exclusive in all cases.
So even with pyuria in a cysto sample, what causes are still high on the list, besides just a bladder problem?
Based on the source, you'd still think about urethral obstruction, animal can't pee, strains hard, big painful bladder. Prostatic or urethral issues like the ones we mentioned that could contaminate voided samples, prostatitis, urethritis, stones, cancer there. Then bladder issues, sure, cystitis, stones, neoplasia, inflammation from blockage, kidney infection, pyelonephritis, maybe you see fever, acting sick, kidney pain, or even just inflammation from trauma, including maybe a tiny bit from the cysto needle itself.
Okay, collection method, major clue, sets the initial direction. But just the start, what about the actual lab findings? What do they tell the vet detective?
The urinalysis itself is fundamental, obviously, finding the pyuria and then using the collection method to help localize, like we just talked about. But here's another really critical piece from the sediment exam.
Yeah.
If you see white blood cell casts.
Casts? What are those?
They're basically little molds of the kidney tubules formed from proteins and trapping cells inside. If you see casts specifically made of white blood cells, that is like definitive proof. It means the inflammation is in the renal parenchyma, the working tissue of the kidneys.
Whoa, okay, so WBC casts, kidney inflammation, smoking gun.
Pretty much. And if the kidneys are really badly hit, you might also see changes on the blood work like a high white count in the blood, leukocytosis, or signs the kidneys aren't working well, like inability to concentrate urine, isostenuria, or buildup of waste products, azotemia.
WBC casts are a huge finding. What else in the urine sediment provides important clues?
Well, seeing bacteria or fungi or parasite eggs in significant numbers, that's obviously a massive clue pointing towards infection being the cause, or at least part of the problem.
Makes sense.
The sources mention using a stain, like Diffquick, on the sediment smear can actually make bacteria easier to spot under the scope. Also, sometimes you can see neoplastic cells, cancer cells, suggests cancer is the cause, and this is a big but from the sources. Diagnosing cancer just from urine cytology can be really tricky. Inflammation itself can make normal cells look weird, atypical, and the urine environment pH, concentration, can also cause artifacts that might mimic cancer cells. So it needs careful interpretation.
So sediment gives great clues, especially for infection. You got to be careful interpreting potential cancer cells. This makes me wonder, are there things that can mess up the lab results, like make the white blood cell count inaccurate?
Absolutely. And this is a really important practical point for you, the listener, to kind of wrap your head around the diagnostic challenges. white blood cells, they're fragile in urine. They can break apart from these pretty quickly, especially if the urine is really watery, dilute, hypertonic, or if it's alkaline, high pH.
Okay.
So giving certain drugs, things that make urine more alkaline, diuretics that dilute it, or even glucocorticoids, steroids, can create those conditions. And that can falsely lower the number of white cells you actually count, makes the pyuria look less severe, or maybe even seem like it's not there.
Huh. Interesting. Anything else?
Yeah, also, if the animal has some underlying condition that affects their body's overall ability to make or use white blood cells, that could also artificially lower the count you find in the urine.
Okay. What about those dipsticks? Those strips they dip in the urine. The sources seem pretty strong on their reliability or lack thereof for pyuria.
Yes. Another critical nugget here, and maybe a surprising one, the sources are really clear. That little square on the dipstick for leukocytes, the white blood cells, it relies on an enzyme called leukocyte esterase.
Right.
That test is not considered reliable in dogs. It's just not sensitive enough. It can easily miss pyuria that's definitely there when you look under the microscope.
Wow. Okay. So useless in dogs. What about cats?
In cats, it's the opposite problem. It's not specific enough. It often gives false positives, so it says there's pyuria when there isn't.
Seriously, false positives.
Yeah. And get this. Certain antibiotics, nitrofurantoin, cephalosporins, gentamicin, can actually cause false positive readings on that dipstick square in cats.
No way.
And don't forget, if the PEP's on anti-inflammatory drugs, those can also lower the actual white cell count in the urine, too.
Okay, so the takeaway is you absolutely cannot rely on just the dipstick for pyuria.
Exactly. The sources flat out say microscopic examination of the sediment is necessary for a valid assessment. Just using the dipstick is considered invalid, period.
Good to know. Okay, so urinalysis. Sediment exam, foundational clues. What other lab tests are really key for this detective work, especially if you suspect an infection?
This is probably the single most important next step when you're chasing down pyuria causes, especially after looking at the sediment, a quantitative urine culture.
Culture. Okay.
The sources strongly recommend doing this on all patients that have pyuria. It's the gold standard. It definitively tells you if bacteria are present, what kind they are, and crucially, which antibiotics are likely to kill them.
Makes total sense if you suspect bacteria. But wait, didn't the sources say something counterintuitive? Like you could have bacteria without pyuria?
That is absolutely correct. Another one of those really important details, the sources explicitly state, absence of pyuria does not rule out bacteria in the urine.
Huh. Wow.
Some animals can just have bacteria hanging out in their urine without mounting a big inflammatory response. You don't see many white blood cells.
Fascinating. Okay, so what if the culture comes back negative? What does that tell the vet about the pyuria?
A negative culture is a big clue, right?
Right.
It helps steer the investigation more towards non-infectious causes, stones, neoplasia, trauma, maybe that drug reaction we talked about.
Right.
It could still be an infection, though, maybe caused by organisms that are just hard to grow in a standard lab culture.
Right.
They call them fastidious organisms, like certain mycoplasmas or viruses, maybe. Or sometimes bacteria can hide out in these things called intracellular colonies or biofilms, making them harder to detect on culture.
Biofilms. Like plaque on teeth.
Kind of similar idea, yeah. A protective layer. And of course, you can get false negatives. Maybe the animal had antibiotics recently, or the sample wasn't handled right, or it sat too long before getting to the lab.
Got it. Culture. Key for bacteria, but negative isn't always the final word. Did the sources mention looking at cells from other places besides urine?
They did. Cytology, looking at cells under the microscope from other samples, can be really helpful. Things like fluid collected from the prostate, or discharges from the urethra or vagina, or even cells collected from a biopsy. These can give clues about localized disease, and sometimes you can spot cancer cells this way. But again, that same caution applies. A negative cytology from these spots doesn't 100% rule out cancer either.
Okay, so many different angles on the lab work. What about actually seeing inside the body? Imaging must be crucial for things like stones or tumors.
Oh, absolutely vital. Imaging lets you visualize things you just can't see otherwise. Find stones, masses, assess organ structure. The sources list the main tools. Standard X-rays survey abdominal radiographs, contrast studies using dye to highlight the bladder, urethra, ureters, ultrasound urinary tract ultrasonography, and sometimes excretory urography, that's an X-ray study using injected dye to look specifically at the kidneys and ureters function.
Lots of imaging options. And I guess sometimes, even with all that, you still need a more direct look, or a tissue sample. The sources mentioned more invasive procedures too.
Yeah, sometimes the detective work has to go a step further. Urethrocytoscopy, using a tiny camera to actually look inside the urethra and bladder. That's often used for persistent problems in the lower urinary tract when other tests haven't given a clear answer.
Like sending in a little drone camera.
Kinda, yeah. And then getting actual tissue samples, biopsies. That's really crucial for diagnosing lesions anywhere in the urinary or genital tract that remain mysterious after other tests. The sources mention different ways to get biopsies, using special tools through a catheter or the cystoscope itself, collecting tissue during surgery, or sometimes needle aspiration or punch biopsy for places like the prostate.
Wow. It really is a layered investigation. Starts with that one clue, Pyuria, and then builds the case using all these different tools, collection method, urinalysis, culture, imaging, sometimes scoping or biopsy, to finally pinpoint the culprit.
Yeah.
So once you do identify the cause,
Yeah.
how do you treat the pyuria?
Another really important point here. You don't treat the pyuria.
Right.
Treatment depends completely on what you found to be the underlying cause and which organs are involved. You treat the disease, the infection, the stones, the cancer, not the symptom of white cells in the urine.
Makes perfect sense. Are there times when finding pyuria means you need to act really fast with diagnosis and treatment?
Definitely. The sources flag this clearly. If the pyuria comes along with those systemic signs we talked about, fever, acting really sick, vomiting, dehydration, high white count on blood work, or if the animal is obstructed, can't urinate. Those are red flag situations. They need aggressive investigation and immediate treatment. They can absolutely be emergencies.
Okay. And medications. You mentioned it depends on the cause, but any general types?
Again, totally cause dependent. If it's bacterial infection confirmed by culture, antibiotics, ideally picked based on that culture's sensitivity results. If it's inflammation from stones, maybe pain meds plus a plan to remove the stones, cancer, chemo, surgery, radiation maybe. It follows the diagnosis.
Got it. Are there any specific drugs the sources say to avoid when dealing with pyuria?
Yes, some important contraindications listed. Big one, avoid glucocorticoids, steroids, or other drugs that suppress the immune system if you even suspect an infection is involved. You don't want to hinder the body's ability to fight it.
Right, makes sense.
Also, drugs that can potentially harm the kidneys, they call them nephrotoxic drugs, like the antibiotic gentamicin is a classic example, should be avoided if the patient is already showing signs like fever, dehydration, exerthemia. Or if you suspect pyelonephritis, sepsis, or if they already have kidney disease, you don't want to push damaged kidneys over the edge.
Good cautions to be aware of. So, after you start the right treatment, how do you know if it's working? How is it monitored?
Monitoring usually involves repeat urinalyses, looking at the urine sediment again to see if that pyuria, the white blood cell count, is going down or ideally resolving completely. And the sources make a point to say, collect these follow-up samples by cystocentesis whenever you can.
To avoid that contamination issue again.
Exactly. You don't want contamination from down low making it look like the pyuria is clearing up when maybe the bladder or kidney issue actually is improving. Transurethral catheterization is another option for follow-up, but you have to weigh the benefit of the cleaner sample against the small risk of introducing infection with the catheter itself.
So even monitoring needs careful technique for reliable answers. What happens if these inflammatory problems causing the pyuria aren't treated effectively? What are the potential bad outcomes?
Yeah, if the underlying cause isn't addressed or the treatment doesn't work, things can get very serious. The sources list possibilities like primary kidney failure, urinary obstruction becoming complete, uremia, that toxic state from kidney failure, septicemia, which is widespread, overwhelming infection, and potentially even death. And there's one specific detail highlighted for male cats.
Oh, yeah.
Pyuria itself is considered a risk factor for forming those urethral plugs made of matrix and crystals, and those plugs are a common cause of sudden, life-threatening urethral obstruction in male cats.
Wow, that's a critical link. A lab finding like pyuria directly connecting to a potential emergency, especially in tomcats.
Absolutely, it raises the stakes.
Well, this has certainly been a deep dive. We started with what seems like a simple lab result, white blood cells in urine. And it's unfolded into this really complex signal, hasn't it? Leading down potentially many different diagnostic trails, lots of possible culprits, needing a real detective strategy.
It really underscores that pyuria isn't the diagnosis itself, it's just the starting point. It tells you, okay, inflammation is here. The real deep dive, the investigation, is figuring out precisely where it is and why it's happening.
And for you, listening, hopefully understanding this whole process based on the sources, helps explain why your vet might recommend what seem like complicated steps, urine culture, x-rays, ultrasound, maybe even cystoscopy. It's all part of building that diagnostic case step by step to really pinpoint the actual cause of those white blood cells.
Yeah, appreciating the complexity behind that single line on a lab report.
It really makes you think, doesn't it,
Mm-hmm.
about how interconnected things are in the body. Like, consider how those risk factors the sources mentioned, maybe a certain diet promoting stones or a procedure that just slightly weakens defenses, how those seemingly smaller things could potentially set the stage for these really complex inflammatory problems that eventually show up as pyuria.
That's a great point.
Or just the fact that even when you know pyuria is present, getting that definitive diagnosis often means methodically ruling out so many possibilities. It takes that layered approach with different tests and tools, always more beneath the surface to uncover.